That's interesting.
This is going to be a big diversion from all the previous talks. I'll be just looking at the Indian stroke trials, what is in store for us in the next few years. Stroke research in India over the last 20 years have been mainly focused on observation studies or case control studies or national stroke registries. There are a few randomized control trials. The one which of a very high quality was the stem cell RCT done by Dr. Kamesh Prasad in AIIMS. And there are small observational studies. And we were, as a country, lagging behind in conducting large-scale stroke clinical trials. And many of the trials that has been done in other countries, in those trials, Indian patients were not recruited. So what is the applicability of the findings from the trials done elsewhere? And over the last 10 years, many countries have developed stroke clinical trial networks, starting from UK, Canada, Australia, and the latest one is the NIH StrokeNet in USA. So the Indian Stroke Clinical Trial Network, it's 3 years old. I'll just briefly let you know the story, how it evolved. The first trial that we did was with NHMRC funding from Australia, looking at the family-led stroke rehabilitation after stroke in India by training the caregivers when they are in the hospital to task shift that when they go home, they will carry out the rehabilitation at home. And this was a very high-quality trial done in 1,250 patients only in India in 14 centers with funding from NHMRC Australia. We all thought it will be a positive trial, but it was a neutral trial. But we learned a lot of lessons from carrying out this important trial. More importantly, we were able to develop a network by default. And this is the network of the ATTEND trial. This paper was published in Lancet. And then this also helped us to carry out another global trial called HeadPost, looking at what is the best head position in stroke in the acute phase of stroke within 24 hours, whether it's head flat or head up 30 degree. And this trial was done in about 11,000 patients in 9 countries, and India participated. We recruited 495 patients from 6 centers in the country. And this was a neutral trial, whether the head is flat or head is up, it does not affect the outcome of patients. The third one, the global trial which we participated in India, is Enchanted. There is a BP arm of the study, Enchanted, 2 arms. One was low dose TPA, 0.6 milligram per kg versus 0.9 milligram per kg. This was published earlier in NAJM. And patients who received TPA, they were randomized to aggressive BP reduction versus standard of care. And this trial did not reach a non-inferiority. Whether it's aggressive treatment or standard treatment of blood pressure after giving TPA, it doesn't make any difference. So these 3 major trials helped us to develop a network, and this Indian Stroke Clinical Trial Network has 2 main objectives. One, to create a state-of-the-art network for clinical trials in stroke, and second is to carry out pharmacological and non-pharmacological stroke clinical trials which are relevant to our country. And it started with 25 centers funded by Indian Council of Medical Research, and this year we have expanded to another 6 more centers, so a total 31 centers. Each center have a coordinator, research coordinator funded by the ICMR, and they carry out all the stroke trials within the network. So we have a network of private hospitals, central government teaching institutions, medical colleges, private and government, and also corporate hospitals across the country. The way it works out is CMC Ludhiana is the main coordinating center. The central coordination is done by ICMR, and we have 2 regional monitoring centers, one at CMC Ludhiana for North Indian centers and Sri Chitra Tindal Institute for the South Indian centers. The statistics is taken care of by the Achyuta Menon Center of Sri Chitra Trivandrum. The entire IT infrastructure is at CMC Ludhiana, and the database has been developed indigenously by a private group in Himachal Pradesh who are the previous IIT graduates. And we have a website where all the trial database are available, and everyone has a username and password, and randomization is done online. So currently, we have 2 ongoing clinical trials, stroke clinical trials, designed by us, approved by the experts of the INSTRUCT, and funded by Indian Council of Medical Research. The Sprint India trial is basically a second prevention trial where a structured, semi-interactive stroke prevention package using text messages, about 74 in number, and 7 videos and 1 workbook, which is given to the patients. And the text messages and videos are automated. It goes to the patient's smartphone, either as a relative or the patient, and we have a follow-up for 1 year. And so this is, I mentioned, the text messages, workbook, and the videos. So what is the current status? We are 25 centers are recruiting. All these educational materials were prepared in 11 languages. It took 1 year for us. We use the professional people to develop this. Currently, we have randomized 2,430 patients, 1214 in the intervention arm and control arm with 1216. As of 22nd November, we could see the recruitment, how it is going on. Hopefully by end of next year, we should be able to finish the sample size that is 5,950 patients. The second one, which is so indigenous to our country, is the Ayurveda treatment, the alternative medicine treatment. Many of our stroke patients, after discharge, they avail this therapy. So it took 2 years for Dr. Shailaja and me to design this trial and get the ICMR approval. And this is already recruiting. Basically, it's a superiority trial comparing Ayurvedic treatment with conventional physiotherapy after 1 month of stroke. And we have taken only ischemic stroke, not hemorrhagic stroke in this trial. And the sample size is 140. If they are randomized to intervention arm, they will have these following treatments. This protocol was designed by the Ayurveda experts in Kerala, the Kerala Ayurveda Medical College, and the entire state was involved in designing this. And currently, we 3 centers in the country, Sri Chittathirunal Institute Trivandrum, Amrita Institute Kochi, and CMC Ludhiana. We are recruiting. Most probably, we will include Jipmer, Pondicherry this year or the coming year. So this is the intervention protocol that they follow for 1 month. For every week, there is 1 type of treatment. So probably in another 2 years' time, we should be able to complete this trial. We have recruited so far 21 patients over the last 7 months. And recently approved trials. One is biosimilar TNK versus TPA. Dr. Padma yesterday would have alluded to this trial, and it has been approved for funding. And the intrinsic trial, there's an Indian trial of tranexamic acid in non-traumatic ICH. This is also approved for funding. This is giving tranexamic acid injection within 4.5 hours of stroke. And we are looking at expanding the network to 100 centers. Currently, we have 30 centers. And also we are planning to go to other Asian countries. Sri Lanka has agreed. Vietnam, Philippines, and Thailand have expressed interest in participating in this trial. The third one is Dr. Dheeraj Khurana. It's looking at the mobile app for the caregivers, whether using that, whether the patient will improve the functional outcome. And double antiplatelet versus single antiplatelet therapy or ICAD. This is another approved trial. These 4 trials, the sample size is more than 2,000, and we are looking for more centers to participate for these upcoming trials. Most probably by middle of next year, all these trials will be active and running. So the first investigators meeting was held in August 2017. All the investigators in the network have equal opportunity to design their own trials and present it to the experts. And it's not that few of us dominate the network. No. So we give every year enough opportunities for others to come up and submit the trial. And we also had a major capacity building meeting for 2 days last year where all the PIs in the network was trained. And there was LOI which was presented, and the national experts reviewed it, and a few trials were shortlisted. And we have international collaboration. There's a global alliance of networks in stroke, where all the stroke clinical networks globally, they join together. And recently we had a joint meeting with the NIH Stroke Net in ICMR in the month of September. That was very encouraging for us. We are in the right track, like what NIH Stroke Net is doing. We learned a lot from them. So who can participate? Now, it should be a stroke center, a minimum of 200 cases a year you should be seeing, and some experience in carrying out research. The most important thing is if there is a motivation, we can help the person to be trained. And we want to expand to 100 centers. ICMR has agreed to a different model where instead of funding one coordinator for all the centers, we can recruit centers where we can pay the centers per patient based on the trials. And in that way, we can quickly enlarge the network rather than slowly going, because most of the networks worldwide, they have more than 100 centers. In India, patient numbers is not a problem, and if we have good number of centers, we should be able to finish large, high-quality trials within 2-3 years with a smaller budget as compared to other countries. So in conclusion, INSTRUCT will help us to answer many of the research questions in terms of conducting large stroke clinical trials, and which will help us to complete many high-quality stroke trials in the next 3 years. From now, India will be presenting in international forum of all these results. And expansion, whether it's a private, it's a corporate hospital, or academic teaching institutions, ICMR is ready to accept all these centers. And also, we are part of this global alliance of networks in stroke called GAINS, which has really helped us to gain the experience from all the major stroke trialists of the world. Thank you. And if anybody is interested, please email us, and we'll be very glad to involve you.
Thank you, Dr. Pandian, apprising the gathering here about developments in the research field in our country, and it's certainly a matter of pride as I see it. And I must compliment the already existing network in India. And perhaps this will enthuse more centers who are represented here to take a decisive path in research, because we don't have basic data regarding stroke. In fact, I believe that Kameshwar is engaged in a cohort study. Perhaps you are aware of that, in collaboration with the University of Rotterdam.
Yeah, and it's an AIMS cohort in Balabgarh.
Yeah, it is a 7-year cohort study, especially for stroke patients. And, and we are very much looking forward to the findings in that. It's quite likely that the Indian cohort of strokes have a different, fundamental disease basis than the West. As you can see that thrombotic lesions are far more common in our country. And then the undetected strokes, mild strokes, they are dime a dozen in this country. So all these have to be brought into mainstream of medical knowledge of practitioners, because by the day people are becoming well armed with the information explosion worldwide. And thank you for representing our country in the World Forum, and we definitely, all of us, wish you greater success in this in time to come.
There is a need for trials in intervention. There are 2 areas which we have not covered. One is primary prevention. There's a trial that is coming up, but in intervention, there are a lot of ideas. There are bright minds here. You're welcome with those ideas. We will try to develop it. We'll help you to design the trial, and we can answer many of the questions that you guys every day see, the practical things in the intervention of stroke.
May I raise another a point of interest in this because it seems reasonable to think that the lifestyle and the high level of stress affecting across age groups in our population is a strong cause for perhaps higher prevalence of stroke in our country.
Yeah, it's one of the reasons.
Is there a thought on having a module for integrating into, say, school education regarding managing stress at a very early age? Perhaps that will pay rich dividends in 2 or 3 decades if this is really adopted by the teaching community. Thank you.
Yeah.
Thank you very much. I'd like to especially thank Dr. Pandian for taking the time out. Really, he's the World Stroke Organization Vice President and he's the principal of the CMC Ludhiana. So taking time out is a very, very difficult problem. So he has been kind enough to accept our invitation and come all the way from Ludhiana. Thank you very much, sir.
Thank you.